first question that we have is, where did you go to school and for how long did you go to school?
My name is Dr. Irala. I was born and brought up in India. I went to med school in India, and actually I went to med school straight from my high school. But during the high school, I did take a biology, which has been my interest ever since I was growing up kid. So in the med school in India is about 5 years. So we do have to go to classes about 4 years, and after that we do have to do an internship to graduate. During that internship, we do have to rotate in the rural areas, and then only you will graduate from med school. Then you go to specialties.
Okay. When did you decide to become a plastic surgeon, and what helped you to make that decision?
Actually, after my med school, I moved to United States, and here my medical school was training was not recognized. So I do have to take the exams to recognize my school training, which I passed those exams. Then I always wanted to be a surgeon ever since I was a kid. So I applied for a surgery training here in the United States for a called residency, which is one of the competitive things to get in during that time. And then I graduated from Northwestern University in surgery, St. Joseph Hospital. So this is about 5-year training. Okay. During my rotation during surgery, in my third year, I rotated in plastic surgery. That's when I saw day one of my rotation, 4 different surgeries by a plastic surgeon whom I rotated. He was actually the chief of surgery at that time, plastics. Now he actually a chairman of the surgery of the department at the University of Nevada, Las Vegas. And then I liked the variety of the surgery. So we did 4 different surgeries that day. Then I liked, that was the time when I thought, okay, plastic surgery looks good. But I rotated for the rest of the month, and then I really liked it, what they do. And that's the time I said, okay, maybe I should think about becoming a plastic surgeon. And then I applied for a plastic surgery during my 4th year training in surgery while I was in it. So we went through selection process, and then I was selected into plastics after my surgery. That's how I went to a plastic surgery. So I went to Wayne State University for plastic surgery training. And then after that, actually I did a 1-year advanced aesthetic fellowship at the University of Birmingham, Alabama.
So I was schooling here. How did your biology courses, either the ones you took back in high school, how did those help you throughout your career?
The biology is always my passion. During my high school, I was really passionate about doing the dissections on these frogs, rats, and also earthworm. That was the most difficult dissection I have ever done. The dissection of the nervous system in earthworm. So I thought, wow, it is cool. Okay. So my biology courses, as I learned the basics, every time I have always some questions when I finish that. And then my teacher used to say, okay, you will learn about it in next lesson. That's when I realized how much I'm into the biology. As you learn more and more into a human touch of the biology, initially it's not much of a human touch, it's more about other stuff. And then I was even more and more interested into the human anatomy and physiology. Then I decided, okay, this is my field.
And what would you do if you weren't a surgeon?
If I am not a surgeon, I would want to be okay, I got to come back again, the answer. Okay? So I have 2 things in my mind. If I was not a surgeon, I want to be a painter.
A painter?
Right.
Okay.
I really likes that. The other one is, if I'm not a surgeon, I'm always more of a guy, hands-on,
Mm-hmm.
and then I want to be a mechanical guy to fix the mechanics. There is nothing in specific in my mind at the time. It could be a car, it could be a plane, it could be something which I really want to figure it out how things work. That's what the principle always drive me even today. Those are the two options when I was growing up.
I like this.
But the body, how they look.
Mm-hmm.
It is always people think about a look.
Mm-hmm.
I always think about how it changes their self-confidence if I change to their body into a certain degree. So it has to come through their mind.
Right.
I can make them like a doll. If that is not what they want, they're not going to feel good. That's why it's important to listen to them. What is their goal?
Mm-hmm.
How we can get that feeling in their mind, not always a physical.
Okay. Which cases are you most proud of surgery-wise?
I used to do the chest reconstruction. It's like they are big surgeries. Somebody lost the part of the chest. I used to do a reconstruction and also major abdominal wall reconstructions. Those are from gunshots, they lost a lot of muscle and intestines are sitting outside. So I used to do those big stuff, and then I like those as a reconstructive surgeries.
Okay.
Whereas the cosmetic part, for a surgical point of view, I do a lot of body contouring after the massive weight loss.
Right.
I'm well known. People do travel long distance to come to see me, and then I do enjoy those. They are very extensive work, but I like it.
Okay. So this kind of goes hand in hand with what you were saying earlier. What kind of surgeries are your favorite?
Right now, as I mentioned to you, cosmetic point of view,
Right.
I do the body contouring for a massive weight loss patient, either after bariatric surgery or after the weight loss by themselves. Because I found it as very fascinating for me is because they have done a lot of hard work to lose the weight either by themselves or underwent a surgical procedure to lose the weight.
Right.
And then I used to do those surgeries myself, two weight loss operations. I am a double board certified surgeon, both in general surgery and plastics.
Okay.
So I can do both. So then they lose weight and then they lost the weight, but they're still depressed.
Right.
Hey, I went through all the hardship of this losing weight. Now I have so much skin here and there. I can't even fit it. My life is even more miserable now than before. That's when I started doing this body contouring, and then you will see a good difference in their way of thinking, their confidence, and the lifestyle.
Okay. On average, how many hours do you work within the week?
It varies usually, but anywhere from 40 to 60.
Okay. And how are you able to balance your personal life and also your professional life with those hours?
I was unable to before. Now I can because I do mostly elective operations now. So because there is not much emergencies I am doing at this moment, so my nights are much better. Before my kids were used to complain. Oh God, no, Dad, when I'm next to you're getting too many calls. I'm not getting sleep. That's what my youngest son complained one day. I was shocked. He was next to me. I said, okay, this is how the life going. Okay, then, but I have done these surgeries for about 24 years.
Right.
And then it's a time for me to change into an elective stuff. So my lifestyle is pretty good.
Okay.
It's no complaint. But I always I don't have no problem to work either daytime or nighttime. If some emergency comes to my patients, it doesn't matter. If it's a day or night, I'll go anytime.
Okay. I think it's pretty good balance. So on the next section. Okay.
What is the next section?
How has the implementation of Obamacare affected your practice?
Okay. It's a little political, but I'm going to be more straightforward.
Yeah, that's fine.
So when the Obamacare came into effect, I moved from my reconstructive surgery into a cosmetic surgery.
Right.
So it basically did not affect me because all these cosmetic procedures are not covered by insurance,
Right.
so I am not affected by that.
Right. Okay. And what are your opinions on the universal healthcare system, and what steps do you think should be taken by doctors, government officials, or patients to achieve this goal?
Is it recording? Okay. Universal care, it's good for hearing.
Right.
This country never faced a universal care. So a lot of people who is talking about universal care has no practical experience of that, how it works.
Right.
But they have seen other countries. Our fellow neighbor country is Canada. It's a universal care there.
Right.
We do get patients from Canada complaining sometimes they have to wait too long there to get their procedure done.
Right.
But there are some good stuff in it. There are some negatives and there are positives. I believe positives are that it equalizes the opportunity for every different group of individuals.
Right.
The care. The disadvantage is it will not recognize who is a priority, who is not prioritized. I was trained in a British system before I come to this country, which is similar to this. So there is a lot of long waiting lines.
Right.
That's a disadvantage. So, but the healthcare cost could go down. That's an advantage. But if a lot of countries who provide universal healthcare system, they are not ideal, that they cannot get everything what they want like in the United States. But the biggest problem in our country is the healthcare system cost.
Right.
Because we will provide everything what they want in like in minutes. In years, the cost is going up, and to an extent that we cannot take it anymore. We do have to have a change of the system. It has to balance something between a pure universal care to the present system. That's what I believe, something in between.
Yes.
Going purely to the universal care, we do know a lot of countries, they don't do well with that system. And we do know about our country at this moment, the present system is not working for us. So we got to figure it out, something which works best for everybody.
Yeah, I think that's... okay, next question. What's something you learned while practicing medicine that you hadn't previously learned in school?
When I was in school, like in high school, all I know is to have some good time with friends, but prepare well for my exams.
Right.
All I need to do is score well, do well in the school. But after I come to med school, I continued the same way first 2 years. And then I did well. That's what we do it, because we don't really get exposed ourselves to the patient care in the first 2 years.
Right.
Just there's no difference between a high school student and a medical student except a different in subjects.
Right.
So you go to the class, you learn things like that. The whole thing changed. Once I was in a third year medical student, then we go to rotate 3 hours every day to see a patient. That's when whole thing changed my life. Okay, the medical school is not like go to the med school, just read about it. It is to apply about it. And the application is not the same to everyone. You do have to change the way you treat the people, not just only with the medicines, with their emotional thing. So I learned all those things from my med school, which has never been in my mind before. I never thought about it. That's what I learned during my med school. Once I became a surgeon, that's even much more important. My job, I'm like a technician. I can go cut, stitch, I'm done. That's not going to make them feel good. I can tell them, hey, give them some pain medication, they feel good, but staying with them, talk to them few words is the one that really going to help them.
Mm-hmm.
So that's what is important, and the same one in plastics.
Mm-hmm.
My clients or me doing operation is different than talking to them, understanding them, make them feel good is different. So it is important to have a knowledge, medical knowledge, and a technical knowledge, and the ability to execute your surgical skills. One set, the other completely opposite set is to be with them, talking to them, understand them, encourage them. It's really important in medicine.
Yeah, for sure.
It's called healing art.
Yeah. Okay. So, how do you stay on top of new procedures that are coming up in the plastic world?
This is like a surgical field is like a technology, keep changing.
Mm-hmm.
I don't do surgeries like what I used to do 15 years ago. They're outdated.
Right.
I have a good friends everywhere in the world.
Right.
Few plastic surgeons in the Europe, Asia, here.
Mm-hmm.
Constantly in touch with them, talking to them what they're doing, things like that. Two, also there are CME courses. Every year I go 2 times, and then big group of surgeons get together, and then a lot of presentations. See that okay, this is what I'm doing. Okay, they're doing. Maybe I should try see if it works for me or not, like that. So that's how we are in keeping our knowledge current, and also with the technological advances.
Right. Okay. Speaking of technology, with the growth of technology and the enforcement of new medical policies, what
is a study outside of health science do you think is most crucial to help as a doctor? So apart from like biology, chemistry, what other course should we be taking in order to be successful?
It is really important for me. This is my retrospective thinking now. When I was growing up, I don't have this type of knowledge.
Right.
Technologically means not always holding the tools.
Right.
What is growing more importantly nowadays is the radiological advancements, radiology. Most of the radiology involves a lot of software and computing stuff. It's really important to have some IT knowledge.
Right.
And also, one they never teach in the med school even till today is when they graduate, all we know is how to treat the patient, but we just don't know the business of the medicine.
Right.
It's really important those two aspects as a medical student to learn some basics,
Right.
and they don't feel like a very much new to when they graduate. So basically a technology, like a computer related stuff, that relates especially to the medical field. Two is the business part.
Right.
Those two, I believe, they are really helpful for you guys.
Yeah, of course.
Did you start up your own practice here?
When I graduated, I took a job, and then I worked under somebody for about 3 years, and then I moved to Texas here, and then I started my own practice.
How did you have any knowledge of like the business of healthcare side, or was it mostly
No,
just
that's what I was telling you. It will be helpful to have business of knowledge. I have no idea.
Yeah.
All I know is how to operate, how to diagnose, how to take care of the patient, but I do not know how to implement the business part of it.
Right.
I learned myself. So it was a struggle first 2 years, there's no doubt. But I learned, but it will be helpful if they teach the students those basics during their training. When I come here, I'm a new guy here, so it will be always going to be a little difficult.
Right.
With time, it will take about a couple of years to recognize you, okay? And then I used to take a lot of emergency room calls and things like that, because I do need somebody to refer patient. I'm a specialist.
Right.
Like a primary care or a general surgeons, or some specialty guys require plastic surgery, they refer patient, because I do not know them.
Right.
It will be hard. So I used to take calls, and then after a year or two, people who saw me in the operating room go and tell them, okay, that guy is good.
Yeah.
Oh, okay, he's good. Maybe we should send it there, like that. Slowly, my practice improved. Remember, in medical field, patients is not the patients. The patients is really important. You just want to do everything like within a minute or two, it won't happen. It is a time-consuming requirement, and then it will take some time to settle down and do things the way you want.
And then, what is the greatest ethical dilemma that you have come across while practicing medicine, and how has that impacted you?
That was when I was in my surgery. I'm a general surgeon too. I used to do trauma surgeries before.
Right.
When they come with the multiple trauma and people who has brain injuries and then brain dead, that's when it's the biggest ethical dilemma came into my real life. I do not know what to tell,
Right.
how to tell. But what helped me during that time is the policy set for those type of cases really helped us to go through it and then make sure the family knows what we are doing, what we have done, everything, what can happen in the future, that why we cannot continue the care, things like that. That really changed me. That's what it is. My medical career itself changed while I was exposing myself to these type of stuff, which I never thought of these things.
Okay. And then our last question.
One more thing about ethics when you're talking about it. Remember, it is not only in a medical field, everywhere ethics are important.
Right.
Especially in a medical field. People are coming and trusting you, keeping their health in your hands. Be very honest and explain in such a way in the layman terms to them so they understand. If you use too many technical words, they may not know it, what we are talking. Just be telling them in their words. That really helps them understand, and also it is ethically good to communicate with them, not in your technical words, in their words.
Right. Okay. And our last question is a little more lighthearted. It is, what is the funniest call or patient request that you've ever gotten before?
Oh, I got many. But just to give you an example, around 3 o'clock, I got a call, patient I operated a week ago, and then I asked them, what's going on? Doctor, I didn't go to my bathroom for about last 5 days after operation. Okay, so what's the emergency here at 3 o'clock? Oh, I thought I should let you know. They're innocent sometimes. That's what. So that is a funny thing from my point of view. Hey, but from their point of view, oh my God, it's already 5 days. I didn't go to bathroom. I got to go. I had to ask the doctor what's happened.
Right.
There are a few times because they don't understand.
Right.
They ask these type of questions.